Next, I will go on to the hot topic of today, that is COVID-19 infections, which, from which our entire country is now suffering. Um, as you all know, it's a virus infection caused by a SARS-2 coronavirus. SARS means severe acute respiratory syndrome, causing viruses. There are many groups of viruses which cause this type of syndromes. No, but so far in the world, nobody has seen anything like this coronavirus, because before all these deadly viruses were confined to certain areas, and quick localized outbreaks which could be contained by strict quarantine measures and all these things. But this virus, nobody has been able to contain it. So it is just, the symptoms are just like that of any other influenza causing virus. Okay, it's just another form of influenza, but there are some differences. The symptoms, as you all know, the commonest symptom is fever. It may be very mild to moderate, in some patients high grade. Cough, cold, and other upper respiratory infection, nasal discharge, nose block. Sore throat is quite common. Commonly, it's described by patients to me as a scratchy feeling in the throat. It's not really pain, it's scratchy feeling in the throat. Fatigue, muscle pain, headaches, sometimes, and commonly, less commonly, they can get diarrhea, abdominal pain, sometimes nausea and vomiting. Loss of taste and smell is a very, overrated symptom, but it does occur specifically to this disease. Many patients can get eye manifestations like conjunctivitis and red eye as well. But the most common symptoms are fever and respiratory symptoms. So, what to do if a patient has COVID-19? This is not really about COVID. I'm just saying what to do and what not to do. Wearing an adequate mask. If a patient is a proven COVID patient, then he has to wear a mask, especially in his house at all times. This is mainly to prevent the transmission or reduce the transmission of the virus to others. And he should, of course, isolate himself in a room as much as possible. Though in our country, it's not always practically possible. Separate room with separate bathroom. Where do we get most of the houses? It's not possible. Maintain distance of 2 meters. That's also very important. And of course, the other people also in the house should wear masks. I'll be elaborating a bit more on masks a bit later. You should practice good hand washing so that, again, the risk of transmission is less. And the most important thing, I would say, and this happens to anybody, it may happen to me also tomorrow. Don't panic. Don't panic. This is in most patients. I've also been treating, and I think Brother Naveen also has been treating a lot of patients recently, at least in the last 1.5 months. And every patient asks us the first question: should I get hospitalized? And I say, no, let's not see. Of course, there are some group of patients who definitely require immediate hospitalization. But fortunately, this group is a little smaller. And that has to be done by the doctor by individually assessing each and every patient. Individually, not generalizing and not, giving the same blanket treatment for everybody. But let me tell you that most patients recover. Most patients, even mild to moderate, recover and can be treated successfully at home, which I have done in the last 1 month. Right now, I'm maybe about 50 or 55 patients under my care right now. And many of them have recovered. Not just mild cases, symptomatic patients. Of course, they are not severe, because if they are severe, by definition, they need to be in the hospital. And I just added as a sort of footnote, BTN. Now, all of you must be wondering what is this BTN. That is our famous Indian way of wearing the mask. What is BTN? Below the nose. Everybody, every Indian, ever since I came back from the Gulf last year, and I've been observing people in India wearing the mask. I think Naveen also gave a beautiful article sometime back in WhatsApp on the correct usage of a mask. But Indian wearing of the mask is BTN, below the nose. You know, why do we wear a mask? Not because it protects us from corona, because police will catch us and fine us. That's why we wear the mask. Okay, or because the government has told, or somebody else has told. But please remember, the entry point of the virus is through the nose, mainly. They say it can enter through your eyes and mouth and all that, but let me tell you now, it's mainly an airborne illness. And where do we start breathing from? From our nose. So if the nose is not adequately covered, and when I say adequately covered, I mean an airtight cover over the nose, then your mask is useless. So this BTN practice has to stop. No, most people, they'll be wearing a loose cloth mask, and that mask will keep slipping down the nose whenever, and then they again put it back up over the nose. Again, it slips down. That's of absolutely no use. And you don't need to wear a mask all the time, like say in your residence, if everybody is normal. But certainly when you go outside, the first thing you should think is, sometimes just due to human mistakes, we forget. Even I forget sometimes when going to, and then I have to come back and wear the mask when going to the hospital. So wear it for your protection, not for others' protection. Wear a proper mask. The best mask, of course, would be an N95 mask. That is by itself adequate. You don't need to wear anything else. But if you cannot wear a N95 mask, wear a cloth mask and a surgical mask over it. But make sure that the fitting is tight. That is the most important thing to prevent corona. It has been shown very clearly. If two people, one of them having corona, are at a distance of 2 meters and both are wearing masks, the risk of transmission of COVID, even from a proven COVID patient, is less than 1%. Now, this is a very important, very simple fact. But how many of us practice it? Even now, even in the midst of this raging pandemic, where do we see? We see crowded, every day we see photos in the papers of crowded markets, crowded religious places. And most of the people are not even wearing a mask. Aren't people aware? And this also, one more thing is, most people, even in the midst of this pandemic, believe that they are immune from this disease. No. God will protect us from this. We won't get. There was some MLA who, I don't know if you have seen that video, who rudely brushed aside a reporter who asked him why on it. Oh, what? There's no corona. That's some UP MLA. He died of COVID just 2 weeks back or so. So don't be complacent. This disease will still be there for quite some time. We don't know how much time. Especially while going out, wear a mask properly and maintain social distancing. That's also important, like hand washing and using antiseptic. I mean, why I'm saying these things again and again, surprisingly, most people don't do it, even today. Home isolation measures for COVID-19, I'm sure most of the people, this is very simple. There are guidelines available in all the COVID helplines. Basically, you have to, if possible, be in a single room with a separate bathroom. But for in India, very often that's simply impossible. So, they can be isolated as much as possible in a separate corner of the house and wear a mask all the time. And the risk of transmission of the disease reduces dramatically after the first week. So people need not be treated like pariahs and kept in a room for weeks to months together. That's not required.
Can I add one thing in home isolation? The most important thing is, like Satish said, wear masks. Everybody in the house should wear masks and maintain distance of 2 meters. And twice a day, walk around the house for 6 minutes. And at the end of the walk, check your oxygen saturation levels. Oxygen saturation should be always above 95. That is the easiest and the earliest way to detect lung involvement in people who have COVID. Especially, this should be done between the 6th and the 13th day from the day you develop symptoms.
Yeah, like I said, each COVID patient should be individually assessed. Okay, individually. Every patient is different. Some patients are asymptomatic, some are mild, some have a little more than mild to moderate, some have moderately severe illness, some have, of course, severe illness. Anybody with moderately severe or severe illness needs to be hospitalized, there's no doubt. Now, how do we make out these things? By two important tests. We can't make out always clinically and by the symptoms. Okay, sometimes patients may look quite okay when you see them. Like now, most of the time we are doing only these teleconsultations. Many times I do video teleconsultation just to see how the patient looks. But the important test to diagnose the severity of the illness, especially when the patient is entering the second week. Now, the timing of the test is also important. If you do it too early, you may not pick up. And of course, there's no point in doing it too late also. So just about when the patient is entering the second week, that is about 6th to 7th day, is the ideal time to do the test. What are the tests? The main thing is a CT scan of the chest. It's called a HRCT, meaning a high resolution CT scan. And certain set of blood tests which we do, which are called like a general blood counts and the inflammatory markers. And along with that, it's important to also assess your kidney function, your liver function, and sometimes in some cases thyroid function, and your most important of all, your blood sugars. So all these things have to be assessed because there are many doctors also advising patients, oh no, you are a mild case, you don't need anything. No, but that patient may be having diabetes. And let me tell you, diabetes and pre-diabetes is extremely common in Indians. Like I said, at least 50% of the diabetic patients in India don't even know that they're diabetic, simply because they never check anything. And especially the stress of an illness. When a patient has some acute illness like a severe or a moderate amount of COVID pneumonia, any illness will always raise the blood sugar, not decrease it. It will always raise the blood sugar. For example, if you have severe nausea or vomiting, your blood sugar won't come down. It will go up. Always any stress increases blood sugar. So we have to be very careful of sugar management. And this point I want to stress in adults during and after COVID treatment. If you have your sugar during the treatment and after treatment should be maintained below 200 by any means, by either whether it's by medicines, and most patients I advise them to take insulin if their sugars are high. Because as you know, in the second week, commonly most patients we give them a course of what is called steroids or glucocorticoids. These always push the blood sugar up because that is how they act. So when that happens, we have to control the sugar by giving insulin. Otherwise, these patients are the ones who are at high risk for the dreaded complication which you all might have heard of. It's called the black fungus in the layman's terms, or we call it as mucormycosis. So each case has to be individually assessed. The severe cases need to go to the hospital without any doubt. Even if his symptoms are not very severe, he has to be go and get admitted to the hospital. By severe, I mean anybody who has a CT score above 15 or even maybe 12 and Anybody who develops persistent desaturation below 90, 100%, there's no question of treating them at home. They have to be hospitalized. But there are many patients who can very well be managed at home, and I have managed them recently in the last 1 month. And these are all mild to moderately severe patients. With the correct treatment, that is by assessing them properly and starting them on what we call antiviral antibiotics and steroids. We try to keep the steroid dosage as short as possible. And there are certain group of patients who are very mild and very don't have much symptoms, or the CT score is very low. We may not even give them steroids. We just give them antivirals and maybe some steroid nebulizations. We have that nebulization called Budicort that is supposed to help to reduce the lung inflammation in the lungs. So my message to the people is contact your doctors early. Don't wait, don't make your own diagnosis. In today's scenario, if anybody develops fever, it is COVID until proven otherwise. Why do I stress on this? Patients don't call till the 8th day, 10th day. I had a patient who called me on the 11th day, on the 1st of May, and he had symptoms on 20th of April. And when I saw the patient, I saw him through a video call. They called me all in panic. And he looked okay to me, but I told them, immediately go and get a CT scan done. And his CT scan score was 17. And they had great difficulty in getting a hospital bed. They got it the next day. But unfortunately, after 1 week, the patient passed away. He was 74 years old and he was otherwise healthy, I believe. He had no history of any other disease. But that's what I said. 11th day. In the midst of a raging pandemic, you contact a doctor on the 11th day in panic because he started disease. That is what should not happen. Once you are diagnosed as COVID positive, do not panic, but get yourself assessed by a competent doctor. And the assessment consists of the timing of the testing also should be right. There's no point in going on doing the same tests again and again every 3 days. We generally do it on the 6th or 7th day, depending on the symptoms of the patient. If the patient has absolutely no cough or no breathlessness, probably it's not required. And then we can decide what treatment to give. Okay, and another question here is about what concentrator do we buy? It's absolutely not necessary to buy any oxygen concentrators, thinking that you may get COVID and you may require oxygen in the house. Because I would say 90% of the patients don't require that. First of all, now the oxygen concentrators are in scarce supply and they have become very, very expensive, I heard. With the prices being now about 3 times of what it was before this COVID epidemic. And what is the point in having a concentrator? Because it just can give you about 5. A concentrator today is to be bought only if a patient, after his treatment in the hospital, once he comes back home, post-COVID treatment, during the recovery period, if he still requires oxygen, then you can buy a concentrator. But if everybody in India wants to buy a concentrator and keep it at home, I don't think that's a feasible option, both for the patient and for the nation. And I don't think there are that many concentrators available in the world.
The reason why concentrators are not available and so expensive today is because of this hoarding that is occurring. People buying in anticipation. So that people who actually need it don't have a concentrator available.
So it's not necessary to buy concentrators in panic. And do it if you want, but I don't think it's really necessary. See, we can always plan. Suppose if a patient requires oxygen, and once the patient recovers from COVID, that concentrator is a total waste. More than that, if the patient requires, you can get an oxygen cylinder. Now I think the oxygen availability has improved slightly. You can get an oxygen cylinder and keep it at home and use. There's no need to get an oxygen concentrator, except in certain circumstances. And also about post-COVID care. Now, this is also a very important topic. Most people who have mild or moderate illness think that after 15 days, the illness is over. I can go back to and jump into my normal daily routine. No, especially if you have been given antivirals and more importantly steroids, your immune system is still suppressed. And also, one thing peculiar about COVID is it increases the risk of thrombosis. And many patients with COVID can have subclinical heart disease. Okay, subclinical, by subclinical I mean unrecognized heart disease. So, moment you feel a little better after 15 days, you go and jump to the gym or something and start doing vigorous workouts. That's definitely not recommended. You have to take rest. Probably for the very least period, for the next 1 month at least, post-COVID. This is after the 15 days I'm talking. So take it easy. Light activity is okay. Keep monitoring your blood sugar and keep monitoring your oxygen saturation. Blood sugar control post-COVID also is very, very important, especially to avoid the black fungus threat. Not just during the COVID when you're taking the steroids, afterwards also. And the steroid effect will be still there for about maybe 2 weeks or up to a month. So till you come out of that, you have to avoid going out, avoid contact with other persons so that you don't contract some other infection like an influenza or something else like that. And good nutritious diet. Avoid great physical exertion during, especially in the patients who have had mild to moderate disease, certain moderate severe disease. Certainly no exercise, especially not vigorous exercise. Control of blood sugars is the most important thing now. And now, okay, there's a question about prophylaxis and of COVID. There's nothing called prophylaxis of. There's no, as such, recommended treatment for prophylactic, meaning preventing COVID infection in contacts of COVID patients. There's nothing recommended as yet, though there has been some recent news about a drug called ivermectin, but we are not sure yet. It is not yet recommended by scientific bodies. Other new drugs are also being developed. Hopefully, they will have a good result, but again, we don't know because they are still in phase 3 trials. And see, normally a phase 3 trial takes years to be done, at least something like 10 years. But because of the urgency of this epidemic, they are fast tracking it and doing it in a quicker phase for the benefit of the public. So there's nothing called prophylactic treatment except all the contact avoidance measures. That is mainly, like I said, mask, social distancing, and hand washing. This partial paralysis question that I see, any disease, any viral disease can have neurological complications also. It doesn't just apply to COVID. Even a simple conjunctivitis, which we all get, can sometimes is well known to cause spinal cord paralysis or what we call a disease called as transverse myelitis, or even we get a syndrome called a GB syndrome. You all might have heard of it, where the patient becomes paralyzed, Guillain-Barré syndrome. So these are all can be reaction to any viral infection. So paralysis is always possible, but it's not caused by the virus itself. It's caused by the virus triggering an immune reaction against that specific cell. In this case, being the nerve cells or the brain cells. That can cause indirectly paralysis. Any other question?
We've got more questions in the chat again. Is it safe for breastfeeding mothers to take the vaccine? If yes, is there a vaccine preference?
Yeah,
I
it's
can
quite
take
safe.
that. Yeah. See, actually, the reason why the government has said that this vaccine cannot be given to breastfeeding and pregnant women is because it has not been studied in this population age group. But that said, the vaccine is given to all pregnant and nursing women all over the world except in India. The Indian government also is going to change their recommendations. And in my opinion, it is absolutely safe to take the vaccine. As much as we know about the vaccine and the side effects, there aren't any side effects on both the mother and the child.
And again, having raised the topic of vaccine, it is astounding that in India, even today, even in the midst of this raging pandemic, amongst all sections of people, be it the rich class, upper class, or uneducated, illiterate class, especially those patients, the amount of misconceptions about the vaccine is just astounding. People just refuse to take the vaccine. And I know of even one or two doctors who have not taken the vaccine. My own colleagues and healthcare workers who have not taken the vaccine, saying that it is not safe. See, about 3 months back, I took my first dose in February and then the second dose in March. It was so freely available, and I took it in the BBMP center only, in the government center. I didn't even go to a private hospital. We got Covishield easily. Now it's not available. Now everybody wants it, but it's not available that easily. You have to register for it and all. But this also we have seen, and I'm sure Naveen also will agree. The vaccine protects you from severe disease. Recently, I treated a household of patients in Malaysia. Their average ages, 4 older people living in a house. The ages were 92, 87, 78, and 70. All 4 of them were positive. But the first question I asked them, have you had the vaccine? They said yes, they have all had 4 doses of the vaccine. And this is almost now 15 days. And all of them have recovered without anything major, just some minor cough and fever. That's it. And with no steroids, no medicine. So
I have had COVID after 2 doses of the vaccine about 2 months ago. I didn't even have a fever. I just had a cold. My wife had a fever for a day. My daughter had only 1 dose of the vaccine, so she got a little more severe, but still none of us got severe disease. That is the message I'd like to give. Take the vaccine. It doesn't matter whether it's Covishield or Covaxin, whichever is available. At least take 1 dose.
And also, vaccine. One more message is vaccine should not be mixed. You either take Covishield or you take Covaxin. You can't take like 1 dose of Covishield and 1 dose of Covaxin. It's not recommended. And if you have already had the infection, see, like getting the infection itself is a form of vaccination. A drastic form of vaccination. Okay, so you have actually had instead of the vaccine is a modified form of the virus. Now you have had the virus itself, so that itself is like vaccination. So there's no need for immediate vaccination after you have got COVID. You can wait for a period of anything from 6 weeks to 3 months before you get, if you have not had the second dose or not had the vaccine.
There's a follow-up question to the previous question for nursing mothers. After vaccination, will the immunity be transferred to my child?
No. Otherwise, we'd have given all the vaccines to the mother and not the child, including all the childhood vaccines. It does not transfer to the child.
So, Naveen, are you seeing patients with very young infants with COVID?
Of course, we are getting newborns with COVID. Because the
Yeah,
mother
because
develops it in the.
I was treating a lady there somewhere in Sarjapur. That lady's mother-in-law was treating. And then both of them also developed symptoms, but the test was negative. But the baby, she has a 28-day baby or a 1 month baby. And that baby, the first day she called me, she said, the baby is also fever. I've got fever. I said, I can't treat the baby, contact a pediatrician, whatever it is.
I have
And
a mother
but the baby
and
was
2 day
positive.
old.
Baby was positive.
I have a mother and a 2 day old, both of whom are positive for COVID. Both of them are asymptomatic right now.
The next question we have is, in these COVID times, would walking outdoors with masks be recommended?
Yeah, I do that. My daughter doesn't allow me to go out of the house without a mask. So I don't really know whether the mask is, because see, I walk with a sort of isolate. I never come into contact with anybody close by. I just walk for 45 minutes in my neighborhood. That too mostly at night at 7:30 or 8 o'clock. But if you're probably going to a more crowded place like a public park, I think definitely it would be a better idea to wear a mask and avoid contact with people as much as possible, or maintain, even if you have to talk to somebody, maintain the social distance. But if you're going to a completely isolated place, it's okay. But any public place, definitely better to wear a mask, a proper mask.
The next question we have is there any kind of contact number you could share in case of an emergency with anyone here?
You mean for COVID?
It's not specific, anything.
See, each hospital has its own emergency contact number. The All India contact number doesn't work just like how 911 works in the US. So it would be better if you make a note of the contact number of your local hospital. Many hospitals send ambulances home. So you can, it depends on which
That
city
is
you
something
stay.
which everybody lives in different areas. Like I said, in cases of heart attack, it's not just for heart attack, for any illness. It's always better to keep a list of your nearest hospital or hospitals and your doctors, whom you know, which hospitals have which facilities, and a contact list of all the emergency numbers in your home anyway. Instead of, if some, see, emergencies are emergencies. They don't tell you, and they don't send you emails and say, I'm coming, you be ready. It just happens just out of the blue. So we have all got to be prepared to some extent. Not, panic in the middle of the night and call, because like I said, for the case of a heart attack, there's no point in calling a regular doctor, then he comes, and then then he gets an ECG from somewhere. And most of the doctors don't have ECG along with them anyway. Then you take them to another nursing home, there the ECG is done, then it shows an MI, then you arrange an ambulance. See, all these things are wasting of time. Any patient who gets a sudden severe chest pain should be suspected to have a heart attack until proved otherwise. It may not be a heart attack, it may be something else. But we don't know. We can't differentiate that at home. And I'm sure a regular doctor also will find it very difficult to differentiate that at home without all the investigations available to you. Just an ECG alone may not be enough. We have to do an ECG. We have to do a 2D echo. We have to do, in certain cases, we may have to do things like a CT scan. But the most important test is an angiogram. So the message, what I want to reach the patient to the hospital, whatever time of the day and night it is, try to get him to the hospital as soon as possible, by any means.
Okay, the other thing is, if you're COVID positive, the numbers you have to note is 1912 and 97456, 97456. Those are the two emergency numbers for the COVID helpline. If you need to go to an ICU, the number to call is 108. Unfortunately, not many ICU beds are available, but the situation is improving in Bangalore. So these three numbers you have to keep in mind if you are COVID positive. 1912. I will do it. I will type it in the chat. Yeah.
And one more thing I want to add in the post-COVID care. COVID is a illness which in many patients induces a state of increased, to put it in layman's term, increased tendency towards blood clotting. And this effect can persist for some time after the infection. So many patients ask us why, if they are not already on any blood thinners, we routinely give them blood thinners. In mild patients, we give them aspirin. If the patient is allergic to aspirin, or if he has also, we give them another drug called clopidogrel. And in the moderate to severe cases, we give them anticoagulants. When he's in the hospital, we give them injectable anticoagulants. Or if he's being treated at home, we give them oral anticoagulants. They are powerful drugs, so they should be used with discretion. But generally, it is better to continue this aspirin or anticoagulants for a period of, very least period of 1 month after the recovery from the illness. This is also very important.
Are there any more questions in the PowerPoint?
Are there any more questions from the audience in general?
Yes, there was one more question where they've asked, if there is no fever, but the oxygen level drops below 90, what must one do?
Run.
Run to the hospital. It has to be assessed. Okay. See, now even though we are in the COVID, we should not forget that other diseases also can cause this thing. You may be having for example, a heart attack. Okay. A heart attack can manifest in many atypical ways. That one of them, and sometimes that can also cause hypoxia. So if you have fever is the most common symptom, no doubt, but it's not necessary. See, if your oxygen saturation is persistently below 90, whatever may be the reason, whether it's due to COVID or whether it's due to something else, you are in trouble. So you need to rush to the hospital where it can be assessed by doing all the relevant investigations, meaning ECG, X-ray, chest scan, echocardiography, etc.
One thing I want to add here, Sangeeta, one common behavior I've noted is that the moment the parents turn positive, the children are packed off to the grandparents without them even being tested, which I think should never be done, because number one, they may be incubating the illness. And by sending them outside your house, you're exposing all the people in that new household to COVID. I've very often seen that after 3 days, the child develops fever and the child is also COVID positive. So if you are positive and your children have not been tested, or even if they are negative, keep them in your house. Yeah. COVID is very kind to children. So most of the time it is just a simple viral fever, but it can be very dangerous to the grandparents. So at no cost should a child from a household which has COVID be sent to the care of the grandparents, or for that matter to any other house.
Also, one important point I would like to add about COVID transmission. COVID transmission, or any viral transmission for that matter, is always highest during the first few days of the illness. Okay, when you just start having the cold and the fever and maybe the sore throat or things like that, the first 3 days, that is the time when you have maximum transmissibility. The risk of, so you develop symptoms, then you go to the lab or wherever and get it tested. The report comes after 2 days. Report is positive. Let's isolate. By the time is actually too late. Okay, actually it's too late. And after the first week, after the 5th day, the transmission risk becomes dramatically low. After the 10th day of the illness, even if the patient is still positive, the risk of transmission of the virus, for what reason exactly we don't know, is low. Okay, so it is a mistake after you get the test reports to simply pack off the patients to kids too, because they've already been exposed. And like Naveen said, most of them, nothing will happen to them. And you send them off to the grandmother's house, the grandmother is going to get COVID.
Another thing I'd like to stress is that there is no need to repeat your RT-PCR after the quarantine.
Yes.
Because this RT-PCR can be positive for sometimes up to 2 months. And a positive RT-PCR after it has come positive once does not mean you got fresh COVID or that you're still infected.
Yeah,
it's just that the virus has been detected in your body.
Yeah,
it does
even
not mean you're infected.
The test cannot differentiate between active virus and dead virus. So some remnants of the virus may be still there in the body. And I have seen patients who keep coming positive for 1 month. They test every 3 days and they keep coming positive. And we learnt it in UAE also. There's no need to do that. But
and remember, if you turn positive, you have to quarantine again for another 14 days. That is the rule.
Yeah. It's not necessary actually. But from for some office workers who have to go back to the office and all that, that may be difficult. The office people will never accept this test.
That is the problem. Yes.
That is the problem.